because such brilliant homeopaths. So I think this was really, really important, and this part should be there. We should have both things together, because we are only meeting each other online, and when you see her interacting, and such amazing 5 cases, I think very nice. And from every case we could learn. So beautiful Vidyapur. So first one was what to say about Chanda. She is, and I go through her cases, whatever she presents every time. And can you see how she picked up the sensation? So here also is important. What we learn here is the kingdom analysis. If you are right there, then you know where exactly, family, responsibility, becoming a burden, little bit of bitterness, too much it's happening, stiffness, and the way she presented. She's always very clear cut and very, very beautiful. Also we learned now because of Prachi how we can now study. Can you imagine 10 years, 5 years back, would we ever give pectin? There was a clarity to come with the mollusk, and then we saw how that child cycle, adult cycle. It was very nice. And our Bhavika is a person of few words. So she just takes conscious, unconscious, one-sided, occult, finish. So our own personalities also are reflected. She's very clear-cut. No more talks. ये है ना चलो दे दो बाबा. So see how our own personalities also get reflected. So that is very beautiful. And Sudha, how to persist, how to go about, and to believe that if you will find the right remedy, the patient will improve. Not like if you come with corn, I am not sure. You should not believe that. So it was very nice. And Rupal is what Rupal is. So this is very nice. And also we saw different approaches being used. For example, we saw repertory being used by Chanda. Our Rupal used associations. So there is no, don't limit yourself. Do whatever you want. And this is what I've learned. As we graduated, we negated the previous and we went to the first one. Don't negate anything. So I can just tell you how I see. थोड़ा प्राची, थोड़ा philosophical बोलूं, आपकी इजाजत हो तो. प्राची मिद्दा. मिद्दा जी आपसे परवानगी लेते हैं. So what is the basic truth about human beings as I understand is pain? This is the eternal truth. And this pain comes because of separation from the universal. So as soon as you separate from the universal, you develop a sense of yourself, which is a delusion. This is the ego. And there the pain comes because you are not complete. And we are all seeking completeness. So initially your ego is very fragile when it is there. So you are afraid of death, like Sudha said. Acute miasm, fear of survival. Because you feel you are that. You have lost your connection with the divine. So in the lower chakras, you will see that the pain is experienced in the physical. Pain will always be. So we say sometimes, patient is not talking. Why is he giving only physical symptoms? This is his level of consciousness. And he will tell pain. And that is why if you see, every time I invite Dr. Balvinder to talk. So in such cases, please use repertory. Please use your theraps. Come to some conclusion there. And then see whatever peripheral little bit you get. And then try and see. Like Louisa Hay says, what is most important is that pain which is translated into the physical, we have to find out what is that pain trying to tell you and make it into a spiritual lesson. Because through that pain is going to, so whatever is the pain, allopathy tries to dilute the pain. Allopathy tries to make you asymptomatic. But pain is here to teach us. That pain has come for a reason. And the pain is the solution. So we have to find that meaning. What is that pain trying to tell us? So, like I'm taking too much of responsibility and my joints are not working. This is his lesson. So how I should not do. So every pain is a answer. So what happens is, first the pain is very physical, then you start experiencing pain in the emotional level. And always we are trying to change. What we try to do is, we try to change the physical. My pain is there, let me take paracetamol, let me reduce the pain. Emotional problem is there, I try to change. Why does my wife not understand this simple thing? I want to change the other one. Only later you realize you have to change yourself. You can never change the other person. So answer is always within you. This is what we miss. As you go further, your pain is experienced in interaction. My colleagues do this to me. You're seeing again the pain outside, but you see now the pain is getting exteriorized more. You're seeing that the pain is more. Your issues become important. Here what we do, So if you're in an urban setting, patients come more with these physical and they are able to talk, my boss, my mother-in-law, my this. So then you tell you a lot of issues. So the pain is in your relationships. How your relationships are affected. So don't say, if it is physical, go there. Use that technique. In fact, I am going to tell Balvinder, hasten up, write your book. It will give us a big hint what to do in such patients. Because you may get somebody from rural, some farmer who can only relate at a physical level. He can only tell this is a pain, relieved by this, that is there. Somebody only talks at an emotional level. Don't change anybody, you change your method. Don't tell them that, don't get frustrated, he is not talking about his family. We saw this. And Jyoti Udupi started telling that first we were doing only psychiatric cases, now we are doing physical, everybody presented physical. So don't close yourself to anything. This is very important. At every level there is a spiritual lesson. So from pain, we have to become painless. That's why opium is so addictive. We have to become painless. But that painlessness is not blunting your pain, but learning from that pain and evolving. So everything is for a purpose. That pain is your teacher. Everybody has pain. And we are all trying to avoid, distract, get away, find a solution how to not feel the pain. This is very anti-evolution. You have to feel that pain. I think even Buddha said this, no? Dukh is the main thing about the human beings. Then he says the desire is the cause of dukh and whatever. But dukh, pain is the truth. As you go higher, then you have the pain that why am I not so creative? Why can't I dance like before? Why can't I do that? And every time, don't deny pain. Stay with that pain. So you have to find out, in a case if you want to be a little more spiritual, you can try, what is the pain of this patient? What is this patient's pain? And at the highest level, the pain is free floating. You don't know what that pain is. And what you have to do is, just experience that pain in totality. There will be no issues with it. There will be no physical problem with you. But you will feel an eternal pain, some deep pain inside you. What you need to do is become one with that pain. And that is your solution. Because when you become one with your pain, all the time, completely in that moment, that pain becomes love. Because by being one with the pain, you dissolve yourself because you're becoming one with it. And through that process, you reach the ultimate. So you have to do two things. One is to address the pain and not exteriorize. Detach. This is not it. This is me and my pain. Just be with the pain. Sometimes even physical pain if you have, even at a physical level, let's say you have a pain. I have a pain in my knee. Just feel that pain. Because pain means give me attention. Pain is crying, give me attention. If you have pain, just feel that pain and become one with that pain. You will see that the pain will go. Okay? So this is what we have to see. That this is the truth. So we have to use all different methods. Whether it is meditation, whether it is physical problem, whether you are going to use your repertorization, you have your therapy book, immediately you open, cough with this and that and left, right, whatever you want to do. Nothing is not correct. Everything is correct. It has to be addressed to the patient who is in front. But use that spiritual part, use your chakras. There, all this will help you. Chakras will help you. As soon as somebody is physical, as we said, no, this chakra 1, this is chakra 2, and then it will help you. So, don't try to make everybody into relationship problem or issue-based problem. Sometimes the physical pain is there like calmia. And then she got a few hints and she said, this is it. So even if you recognize you get 5-6 remedies, then your issue in very non-specific way it comes, like how did he serve my father when he was drunk? How did he react to that? How beautifully she did it. So then there she pinned the case that it is this. So sometimes it is not as vivid, but the physical is vivid too, because start with the physical, come to whatever it is, and then see what are those subtle points which will tell you his level of evolution. So somewhere you start with your issues, somewhere you use that issues later. So be very flexible and you fit into the shoes of the patient and follow accordingly. So that's why you see from day one, from my time of module, there was never a time where Dr. Balvinder has not spoken. So don't deny that. It is very important. But we also get patients who talk. And even in those physical cases, even Balvinder says now, my prescriptions are better because now when they come, I get these few remedies I know in this particular case, then I know which one to pick because of the personal evolution. What else to say?
Anything about crustaceans?
Crustaceans, amazing. So what is the lesson from this crustacean is, this is what I have learned. That exactly what Rupal did. I have given cases of crab, I have one case of lobster, but what has happened is, every time I have given a mollusk. And then I have realized it's an angry mollusk.
Yes.
So if it's an angry mollusk, you might think of murex. You'll think of all the angry remedies there. But when it doesn't work, please give crustacean. It's a very important lesson we have to learn. That very often she's struggling with mollusks. She had to just go one more with that fire element at the third. In and out of a mollusk is inside the shell or outside the shell. Whereas the doubleness of the crustacean is in the water or out of the water. So it has certain snake qualities. Suffocation is very, very strong. So fire element is very, very strong. So I think every case we had learnt a lot, and they were all very different, and each case had a very beautiful. So we should have this also. Part of Conclave should not be only fun. I had first time said, Conclave, I don't want to have it only learning, let's have fun. But now we should not go to the other extreme. We should also have a little bit of learning. And last time those cases, 4 cases, I just can't forget. Mamta had given one case of Thea, and then I have given a patient of autism with Thea, and I always bless her whenever I have such cases. Thea always comes in my mind. Caladium was a wonderful case, and then we had the eagle and beautiful cases. Which was the other one?
Photos of animal.
Cheetah had president cheetah.
Yeah. So what I want to tell you is,
You had done, no, cheetah?
my biggest joy,
And Tushar had done something, no? Tushar had done.
My biggest joy is to see that I have already here and some who could not come, at least 14-15 teachers who are simply great and will carry this work ahead, and I don't know how to thank, and I'm very happy when I see this. It's like we all learn. Truth prevails. And I believe, yes, the life has to continue and our good work has to continue. So just now that we are there, what are we doing tomorrow? What is the plan? There are